Ketamine is a medication that's been around for a long time. It's a dissociative anesthetic, which means it allows you not to feel pain by disconnecting your brain to the pain. It's been an anesthetic and a tool that anesthesiologists use back since the 50s. It sort of has come and gone in popularity. It's in its bad forms has been a date rape drug, Special K, that's out on the market, which basically, if given to somebody, will dissociate them from what's going around them, and that's how it becomes a date rape drug. In the appropriate dosages, though, ketamine is being used now to treat chronic pain syndromes for patients that have had so many different medications tried and nothing's been working. This has been a wonderful way to something the body just hasn't seen. And really what it does is sort of reboot the computer. It scrambles the brain to the point that the normal channels of pain get totally scrambled. When the ketamine is gone, a lot of the times those channels act normally again. So in someone that has had a process that has been so chronic that they have made permanent changes in the neural pathways, sometimes just scrambling these pathways and having to come back again allows the patient to have a more normal existence. Most recent one was a bilateral mastectomy who had infections afterwards and had this horrific nerve pain throughout the chest wall. She was at bed rest. She said 16 hours of the day she was in bed because she just couldn't get up, couldn't move. Her goal was to go to a family reunion in Japan. She had been to a bunch of pain providers, all the medications that I would have tried, all the things that I would have done. And in a dinner that I was having with just one of my colleagues, I mentioned that we were doing this. Then the next week she sent us this patient. She was able to, after 5 treatments, we got her down to, she only needed to be 10 hours in bed. Right? So we gained her an extra 6 hours of being upright, which she just hadn't had for about 4 or 5 years. It allowed her to make the trip, with medications, with other things. This wasn't all of a sudden she could pick up her pallet and walk. I mean, she still had pain, but it was something that her body had never seen, and was able to, she was able to function at a reasonable level. The other way that ketamine is being used is in post-operative pain with the use of narcotics and with the use of opioids. So broadly in the community, a lot of people are coming in that are already before their surgery taking a large dose of narcotics. And by virtue of that, what do you do to treat their post-operative pain? So they're having a hip replaced. They're having a large abdominal surgery. They're going to have a lot of pain post-operatively, and if we can't use narcotics, which is the mainstay, the use of ketamine is also another way to do this. So starting a ketamine infusion after the surgery to reduce the amount of pain that they're having, allow them to get back onto their regular opioids, and for 2 or 3 days post-operatively have this ketamine going. And it's just, again, a medication the body hasn't seen, be able to get them through the post-operative phase, allow them to participate in physical therapy, and after 2 or 3 days just sort of take it away and put them back on their chronic medications. And usually it's a very effective way to help these people that are taking large doses of narcotics get through a surgical procedure.